Hello everyone, I am Dr. Sarita Jain. In today's video, we are going to discuss about the HPV vaccine. HPV vaccine protects against the cancer caused by the human papilloma virus. This is a common sexually transmitted infection. It can lead to cervical cancer as well as the cancer of vagina, vulva, penis, anus and throat. It also protects against genital warts. This vaccine is recommended for people between 9 and 45 years of age and provide protection against these serious health issues. So what is HPV vaccine? HPV vaccine is a series of shots that protect you from human papilloma virus. This is very common sexually transmitted infection. Human papilloma virus can cause various type of cancer and genital warts. Specifically, the vaccine helps in preventing HPV infection that could lead to cervical cancer, vaginal cancer, vulvar cancer, penile cancer, anal cancer, oropharyngeal cancer that happens at the back of the throat and genital warts. Now it's crucial to know that vaccine is preventive. It's not a treatment. It won't cure existing HPV infection, but it can protect against other HPV strains that you have not encountered yet. There are different types of HPV vaccines available. So let's discuss one by one about them. First is Gardasil 9. This is the only HPV vaccine currently available in United States since 2017. This provides most extensive protection against HPV strains. It protects against HPV 16 and HPV 18. These high-risk strains are responsible for 70% of cervical cancer and 90% of anal cancer and many cancer affecting the throat and genital. This vaccine also protects against HPV 31, 33, 45, 52 and 58. These additional high-risk strains contribute to 20% of cervical cancer. Apart from this vaccine also contains HPV 6 and HPV 11. These low-risk strains cause 90% of the genital warts. While they don't cause cancer, they are contagious and troublesome. Vaccine prevents against from these strains and protects individual and their partner from the risk of genital warts. Gardasil 9 is highly effective in preventing both cancer-causing and non-cancerous HPV infection. Now next vaccine is Gardasil. This was introduced in 2006. It was the first FDA approved vaccine for human papilloma virus. It protects against HPV 16 and HPV 18. It is linked to 70% of cervical cancers and 90% of anal cancers and various throat and genital cancer. It also provides protection against HPV 6 and HPV 11. These are responsible for 90% of genital warts. Original Gardasil does not cover additional HPV strains that causes 20% of cervical cancer. While Gardasil 9 reduces the risk of cervical cancer by 90%, original Gardasil provides 70% protection only. Third vaccine available is Cervarix. This was approved by FDA in 2009. This vaccine specifically targets high-risk strains of human papilloma virus. Those are associated with cancer. It offers protection against HPV 16 and HPV 19. However, Cervarix does not protect against the HPV strains responsible for genital warts. It primarily focuses on reducing the risk of cervical and other HPV related cancers. HPV vaccine is recommended for everyone regardless of sex or gender, ideally before they become sexually active. Now, who should get the HPV vaccine? First group for HPV vaccine is children age 11 to 12 years. This vaccine is part of routine immunization schedule for this age group. However, it can be given to children as young as 9 years to ensure protection before they become sexually active. Next age group is adults up to age of 26 years. Vaccination is recommended for adults in this age group also, including those who may have started the vaccination series as children or teenager but did not complete it. Vaccine can also be given to some adults aged 27 to 45 years. In 2018, FDA expanded the vaccination age to include adults up to age of 45 years. This recommendation is based on studies showing that the vaccine can prevent HPV infection in this age range as well. Mainly age limit for vaccination is because many individuals may have already been exposed to HPV by adulthood, and which can reduce the vaccine's effectiveness in those cases. However, middle-aged adults with few or no sexual partners could still benefit from vaccination, especially if they are starting a new sexual relationship. HPV vaccine is not recommended for following age groups. First is pregnant individual. There is limited research on safety of HPV vaccine during pregnancy. So it's advised to wait until after childbirth to get vaccinated. But if you are pregnant after receiving a dose, there is no need to worry as the vaccine is not linked to pregnancy complication. If you have had a reaction to previous HPV vaccine dose or to any of its components, then you should not receive this vaccine. If you have any moderate to severe illness, then also it's better to postpone vaccination until you are well. Now, how does the HPV vaccine work? HPV vaccine does not contain the live virus, but instead it uses virus-like particles to mimic the outer surface of human papilloma virus. These virus-like particles stimulate the immune system without causing an infection. The vaccine triggers the body to produce antibodies against human papilloma virus. If you are later exposed to actual virus, these antibodies will recognize and neutralize it. Thus prevents infection and reduces the risk of HPV related disease such as cervical cancer and genital warts. Let's discuss HPV vaccination schedule in different age groups. So first age group is 9 to 15 years of age. In this age group, two shots are required only. First shot is the initial shot and second shot is given 6 to 12 months after the first shot. Reason for only two shots in this age group because the immune system responds robustly, providing strong protection with just 2 doses only. Number of shots required in age 15 and above is 3. First shot is initial dose and second shot is given 1 to 2 months after the first shot and third shot is given 6 months after the first shot. Reason in older individual for 3 shots is because they actually have less robust immune response compared to younger individuals. So 3 doses are recommended for optimal protection. In immunocompromised individuals, 3 doses are required because they have weak immune response. So to achieve the same level of the protection as those with healthy immune system, they will need 3 doses. There are some important considerations. First is regarding the vaccination timing. It is best to receive the vaccine before becoming sexually active as it provides the most effective protection before potential exposure to HPV. Next consideration is regarding booster dose. Currently, no booster shots are recommended after completing the vaccination series. And next is about missed doses. If a dose is missed, it should be administered as soon as possible without restarting the entire series. Now, benefits of getting the HPV vaccine. This vaccine significantly reduces the risk of cancer caused by the HPV such as cervical, anal, penile and throat cancer as well as genital warts. Since its introduction in 2006 for people assigned female at birth, there has been a significant decrease in cervical cancer rates. HPV infection linked to cancer and genital warts have dropped by over 80%. This vaccine has been available for males since 2011. It prevents HPV-related throat and anal and penile cancers in males. Vaccination in males is especially important due to the rising incidence of HPV-related throat cancers. By vaccinating males, we can reduce the risk of transmitting high-risk HPV strains to their partner. Thereby, we can protect them from the cervical cancers. Next benefit is vaccination should be given before they become sexually active, because if we provide vaccination before becoming sexually active, it provides the strongest protection against HPV infection and related health complications. Now, what is the duration of vaccine protection? Gardasil remains effective for 10 years after vaccination. Cervarix also shows protection for more than 10 years, and Gardasil 9 remains effective for at least 6 years. Now, what about the need for booster shot? Current research indicate that the initial series of shots provide long lasting protection and booster shots are not required. Overall, HPV vaccine offers substantial benefits in reducing the risk of multiple cancers and genital warts, and it makes a crucial preventive measure for both males and females. Now, what are the side effects of HPV vaccine? Uh, HPV vaccine is considered very safe, but like all other vaccine, it can cause some mild side effects like injection site reaction. Some people may have soreness, swelling or redness at the site where the injection was given. There can be mild headache or fatigue after receiving the vaccine. Some people may experience temporary discomfort in muscles or joints. Some individuals may feel lightheadedness or dizziness, especially shortly after the shot. A low-grade fever can occur as a response to the vaccine. There can be mild nausea or vomiting also, but these usually resolve quickly. Severe reactions are extremely rare with this vaccine. Some people may experience an allergic reaction. Symptoms can include difficulty in breathing, swelling of the face or throat, or a severe rash. Immediate medical attention is necessary if this occurs. There are no known long-term side effects associated with HPV vaccine. It has been extensively studied and monitored for safety since its introduction, and it continues to be a crucial tool in preventing HPV-related cancers and diseases. Overall, the benefits of HPV vaccine in preventing serious health conditions far outweigh the risk of these mild and temporary side effects. So this was all about the HPV vaccine. If you found this information useful, please like and share the video and subscribe my channel. Thank you.